Hello, a family nurse practitioner, and today I want to talk about something that's deeply personal to me and central to my practice: hormone therapy for trans and non binary individuals. Whether you're considering starting hormone replacement therapy, you're already on it, or you're just curious about how it works, this is for you. But before I dive in, I want to say something that guides everything I do in my practice. My patients are the experts of their own bodies. I am simply here to assist them in accomplishing their goals, whatever that may look like. That is not just the philosophy, that is how I show up every single day. You know yourself better than any lab value or any textbook ever will. My job is to meet you where you are and help you get where you want to go. Now, let's talk about hormone therapy. When we talk about hormone therapy in gender affirming care, we're talking about using hormones to help align your body with your gender identity. For some people, that means feminizing hormone therapy. For others, it's masculinizing therapy. And for some non binary folks, it might be a carefully calibrated balance of both or something in between. There's no one size fits all approach, and that's actually the point. Your body runs on hormones, chemical messengers that tell your cells what to do, how to grow, how to function, how to develop. During puberty, your body naturally produces certain hormones based on your sex assigned at birth. But if your internal sense of gender doesn't match those hormones, your body can feel fundamentally misaligned. That disconnection is real. It's physical, it's emotional, and hormone therapy is about correcting that mismatch in a way that's safe, monitored, and centered on what you actually want. Let's talk about feminizing hormone therapy first. If you're assigned male at birth, that identify as a woman or feminine spectrum feminizing therapy, it typically involves two main components: estrogen and an androgen blocker, often called an anti-androgen. Estrogen is the primary feminizing hormone. It promotes breast development, softens the skin, redistributes body fat to more feminine patterns, typically around the hips and thighs, and can affect mood and how you experience your body and your sexuality. The anti-androgen blocks testosterone, which is the hormone that drives masculine development in the first place. When you lower testosterone and introduce estrogen, your body essentially re enters a kind of second puberty, but this time in the direction it feels right for you. Common anti-androgens include spironolactone, which works by blocking testosterone receptors. It also increases potassium, so we have to keep an eye on kidney function, electrolytes. Then there's biclutamide, which works differently and doesn't carry the same potassium concern. And there are GnRH agonists like leuprolide, which suppress the pituitary gland itself. And that's a more aggressive approach, but sometimes the right tool for the job. Each one has different monitoring needs and different side effect profiles. So this is not a one medication fits every one situation, which is exactly why having a provider who actually knows the space matters. Now, masculinizing hormone therapy is different. If you're assigned female at birth but identify as a man or masculine spectrum, you're typically using testosterone. Testosterone does a lot of work. It deepens your voice, and this is important to know because it's one of the few changes that can be permanent. It increases muscle mass and bone density and increases body hair and can trigger male pattern baldness if you're genetically predisposed to it. It redistributes fat to more masculine patterns around the abdomen, and it typically increases libido and can affect mood, energy, and drives in significant ways. Now, here's something I want non binary folks specifically to hear. You do not have to go all the way in either direction. Low dose testosterone is a real valid option. It gives you some of the effects you may want, maybe a slightly deeper voice, a little more muscle, some shift in fat distribution without full masculinization. We titrate to your goals. That's it. That is the entire job. Testosterone comes in several forms. There's injectable testosterone, usually given weekly or every 2 weeks, which gives you stable levels over time. There's testosterone cream or gel that you can apply to the skin. There are also patches, and there's even an oral form, though that's less commonly used because it can be harder on the liver. The form you choose depends on your lifestyle, your preference, your access, and sometimes other health factors that we consider together. Here's something crucial. I want everyone to understand these changes do not happen overnight. Hormone therapy is a marathon, not a sprint. Some changes show up in the first few weeks, like mood shifts, skin texture changes, libido changes. Others take months or even years to fully develop. Breast develop on feminizing therapy can take 1 to 2 full years. Voice deepening on testosterone typically begins around 3 months, but can take 6 months to a year to fully settle. Fat redistribution can take 1 to 3 years. Body hair changes on testosterone often take 2 to 5 years to fully develop. I tell my patients this up front because I want you to have realistic expectations, not because the results won't come, but because your body deserves the time to do this right. Now let's talk about monitoring because this is where a lot of people get gaps in their care. When you're on hormone therapy, regular blood work is not optional, it is essential. We are checking your hormone levels to make sure they are in a therapeutic range that aligns with your goals. We are also looking at estradiol, testosterone, and sometimes LH and FSH, depending on where you are in your therapy. We are monitoring your liver enzymes, your kidney function, your blood counts. One reason because testosterone in particular can increase your red blood cell count, which can thicken your blood if it goes unchecked. We're also looking at your lipid panel and metabolic markers because hormones affect your cardiovascular system and your metabolism in ways that matter long term. This is not policing your therapy. This is about keeping you safe so you can be on hormones for the long haul. I want my patients thriving at 40, at 50, at 60, and beyond. That only happens with good monitoring. Let's bust some myths while we're here because there are a lot of them floating around. Myth number one, hormone therapy is dangerous. The reality is that hormone therapy, when properly monitored and dosed, has a well established safety profile. The risks are real, but manageable. And for most people, the mental health benefits of gender affirming care far outweigh those risks. Multiple studies have shown that gender affirming hormone therapy significantly reduces rates of depression, anxiety, and suicidality in trans and non binary individuals. That is not a small thing, that is life saving medicine. Myth number two, you have to have surgery to be trans. Absolutely not. Hormone therapy is a standalone option. Some people never want surgery. Some people want surgery eventually. Some people want hormones and nothing else. All of it is valid. There is no checklist you have to complete to be trans enough. Myth number three, once you start hormones, you can never stop. That is not true either. Some changes are reversible if you stop therapy, though others, like voice changes from testosterone, are permanent. This is something we discuss thoroughly before you start so that you're making an informed decision, not a pressured one. Myth number four, you can only get gender affirming care if you have a therapist's letter. That's outdated gatekeeping. That's an outdated gatekeeping model that has largely given way to informed consent practices, which is what I use in my practice. Informed consent means you understand the risks, the benefits, the timeline, and the monitoring requirements. And then you make the decision for yourself because, again, you are the expert of your body. Well, let me close with this. Access to gender affirming care should not be determined by your zip code, your insurance status, or whether you happen to live near a provider who is knowledgeable and affirming. Telehealth has changed that. It has opened the door for people who have been shut out of this kind of care for way too long. And that matters enormously to me, personally and professionally. If you have questions about starting hormone therapy, if you're already on hormones, and if you feel like your care has been reactive instead of proactive, or if you just want to work with a provider who sees you as a whole person and not a diagnosis, I want you to hear this and I want to hear from you. You deserve care that actually fits your life and your goals, and that is exactly what we do here. I'm Lorri Price, family nurse practitioner and founder of Vermae Telehealth. Thank you for spending this time with me today. I'll see you in the next one.